here. Thank you for making time to join us this morning. Give it just another minute to allow people to get in and get settled. Hello and welcome to everyone. Thank you for being here on a Tuesday morning. I know everybody's got a lot going on, getting ready for finals coming up this month, but we really appreciate you making the time to be here today. I'll give it just one more minute. Thank you for putting your names into the chat. Hello, Nicole. Yay, welcome. I love seeing names that I know, and I can't wait to get to know everyone. So thank you for being here. I think we can go ahead and get started. Let me get my feet going down. Thank you for being here today. My name's Jerry Walcott, and I'm just going to be your facilitator for today's presentation. Thank you for being here on Tuesday, May 2nd. And we'll be going from 10 o'clock to 11 o'clock today and talking with Ohlone College and learning about Alameda County Mental Health Navigators, a pilot program to improve access to care. I'm just going to go quickly through a couple of housekeeping items. Slides will advance for me. All right. So just a couple of the housekeeping items. Closed captioning is available for today's webinar, and you are able to add questions at any time to the chat. We're probably going to hold all of our questions until the end, and then we'll facilitate the question and answer session from there. You can also at any time put your questions into the Q&A on your dashboard, and it will hold our questions there, and we can answer manually or wait till the end. There are a couple of more webinars coming up if you haven't already registered. Tomorrow's will be the systems webinar, and it's titled, Where Can I Go? Student Mental Health Navigators Panel, where you hear more about Alameda County programs and hear from the actual students that are participating in that program. Then on May 4th, we're going to come back here from 10 to 11 and join us for trauma-informed communication practices with Adele James. And I think that that's going to be a fabulous presentation. One thing I want to note on this is that we are going to be starting a little earlier tomorrow. So from 9 to 10 instead of 10 to 11. Just wanted to draw your attention to that. All right. And at this time, I'd like to take a moment to introduce Dr. Sing-Ling True from Ohlone College. Thank you so much for joining us today.
All mine?
Yeah.
Okay, great. Thank you, Jerry. Thank you, everybody, for making time to join us today. I just want to say for tomorrow's session, it's the systems-wide webinar, so there's other content, and I think we have about 20 minutes to we'll actually feature a couple of our student navigators. But today, I'm really pleased to be invited to share the work that we're doing in Alameda County. And so before I get going, I'll just tell you a little bit about myself. My name is Sang, and I'm with Ohlone College. I work at the Student Health Center there, and this is my 24th year. Actually, we're wrapping up the year. So I've been there for a really long time. I started back in 1999, and so I sometimes tell students, this is my 4th decade on campus, which is a really long time, and it makes me feel old, but that's okay. My background is actually in public health, so I'm not a mental health clinician, but I do work on largely mental health programs, but on other things that we do at the Student Health Center. And I left my contact information here, as well as our Student Health Center webpage, and then information about our Navigator program. Okay. Here, I don't think I can advance my slides. Okay, got it. Do you want to give me access so I can advance it? No? Okay. Okay. All right, got it. Okay, so today I want to go over just a little bit about Ohlone College and also the Alameda County landscape, so you all have a sense of the work that we're doing in the county. And then for the program itself, I want to share why we decided to do this, what it is, who's part of it, how we do it, and then how we communicate with our students. Then I have a little bit of data and evaluation to share. And of course, a question that many people ask is, how is this funded? And then we'll hopefully share some next steps for this program. Okay, so about Ohlone College, it's a beautiful campus for those who've been by or and have visited. But let me just here. The picture up here, you can see there, we're right on the base of the Mission Peak area. Our annual student head count is close to 17,000. You can see their gender breakdown there. And then in terms of our emerging adulthood population, it's about 47%, which are considered students 18 to 24. So I like to think of our school as a little bit more on the traditional student population, a little bit more of a traditional student population. And then I added in there some information about our race and ethnic breakdown. It's a really diverse campus. A little more than 2 in 5 of our students are considered Asian Pacific Islander. And then on the bottom there, I just added some information sharing about what our retention and success rate is compared to what it is at the state of California. And for our retention rate, it's similar to what we're seeing statewide, and then our success rate's a little bit higher. But this data is from Data Mart, as I'm sure you may know for those who go into Data Mart regularly. So I just want to say that at Ohlone College, we actually started providing clinical mental health services almost 20 years ago. Actually, our first mental health clinician was a full-time faculty member who started in 2004. And so it's been, like I said, almost 20 years. But it wasn't until 2012 when we actually started what we call our Step Up program. And you can see there it stands for Students Together in Education and Prevention. And the reason we started was actually out of tragedy. We actually had a member of our campus police department die by suicide. And it really shook our campus. And I think at that time, this is, I guess, 13 years ago. 11 years ago. We didn't know how to respond. We didn't know, what to do. And so the health center held, a number of support groups and things like that. But at that time, my former director, Sally Bratton, some of you who are on this webinar may remember her, she really took action and decided we've got to do more than just provide mental health, clinical services. We've got to start looking at prevention, early intervention, and really doing a lot of education. And so that's how our program got started, with actually funding from our county behavioral health. And so while we have our clinical side, we also do a lot of work on the prevention education side. And so the program that I direct is called Step Up Ohlone. We, as part of our program, we emphasize, or we focus heavily on what we call student engagement programs. At Ohlone, I'm really happy to say that the majority of our apportionment dollars, which all of our schools have, actually goes to support our student engagement programs. And so I put in here the key one that are really our signature program, Student Wellness Ambassadors. I know many campuses have that. I think we've been doing this for about 7 or 8 years. And then we also have our student mental health advocacy program, which we've been doing for a number of years. But I'm really happy to say that that program is going to be transitioning to a certificate program in the fall. And then we have a mental health navigator program, which is going to be the focus of today's webinar. This year is the first year that we're piloting what we call a student wellness counseling, peer counseling program. We're going to continue that program next year, but it's actually going to be morphed under the Student Wellness Ambassador program. And then lastly, we have funding from the county to really support students who are interested in pursuing behavioral health careers. And so we actually have a scholarship and mentorship program as well. And so, like I said, we're just so pleased to be heavily invested in programming for students, by students, with students. And so today, like I mentioned, it's really the focus is going to be on the Mental Health Navigators program. Alameda County, this is where we are, right here in the red. I think it's about 1.3, 1.4 million is our county population. And then in Alameda County, we have 7 community colleges. We have 4 up here, which is part of the Peralta Community College system: Berkeley City, Merritt, Laney, and College of Alameda. Laney and Merritt are in Oakland. College of Alameda is in Alameda, and then Berkeley's in the city of Berkeley. And then the other 3 that are throughout parts of the county, Las Positas College and Chabot, they are part of the Chabot Las Positas Community College District. So we've got one out here in Livermore, and then Chabot's in Hayward. And then Ohlone, we are actually considered South County, and we are a single campus district, which for those of you who are in the system know that sometimes it's easier to be in a single district, and other times it feels a little bit lonely, but like I mentioned, the project itself, and I'll cover this, is really not, it's really countywide, or at least that's the aspiration that we have. In terms of our student headcount, I grabbed this from Datamart as well. For fall semester, the headcount was over 54,000 across all 7 campuses, and the annual headcount is about 89,000. And I like to always put this in here when we're talking to our community partners, because for agencies in the county, many will know about community college, some have attended one themselves, but when I think about the system as a whole countywide, letting our partner agencies know that when we think about community college, the community college system in the county that serves more than 50,000, it's quite a sizable population. And so we always like to put that into context. And of course, of all of our campuses, Chabot has a high student population. The why. So I want to go ahead and get into the program itself. Why did we start the Mental Health Navigator program? This is a slide that I'm not going to walk through and explain. I only put this on here to show you that the referral process is really messy. And I think many of you who, work in mental health, or even just, medical services, know that we can't serve all of our students in the way that we'd love to. We are not the PCP for any of our students. And so oftentimes, at least for many of the colleges that I'm familiar with, and in Alameda County, we have a session limit. Students can access mental health services on our campus for up to 6 sessions per semester. And so, they'll come in and see our clinicians. And when they reach a session limit, just because we have to, put some boundaries on there, for many years, we would, put together a 1-page or a 2-page referral form. And we say, we are hitting your session limit. We'd love to make sure that you get connected to another agency so you can continue your treatment. We hand them a referral form. And I would say 95, 98% of the time, that referral form stays in the student's backpack. We even got to the point where we would start numbering our referral forms, referral sheet, just to see how many we actually give out, and to see, and really trying to figure out whether students are actually calling, and we find that they're not. And so there were times when our clinicians would be on the phone with, let's say, Access, our Access program of the county, for 30, 40 minutes, and it just wasn't feasible. And so as much as we want to make sure that our students are able to access, continued services, giving students a list of places to call just wasn't something that we actually were seeing happen. And we would follow up sometimes and find that, no, they don't call, they don't know how, they're not sure, they're nervous, or what have you. And so because of that, we thought, what if we actually had a program where we trained students to really learn about the community mental health agency and the community, and they would then help their peers, be able to connect to services. And so that's really the why we decided to do this. And so here I want to talk a little bit about, again, what I mentioned earlier, but really outlining the specific reasons. And so the big one is that we want to be able to shift students who need longer term care to those services. We know that sometimes 6 sessions is just not enough. Some students come in and only do 2 or 3 sessions, and it's fine and it's beautiful and they can continue with their studies. But for other students, that's not really the case. We also have a long semester breaks at Ohlone. I think it's 5 weeks during the winter, and then during the summer we also have that break. And so, and for some of our students, those long breaks are some of the most vulnerable times that where our students really need care. And so we thought, how do we really make sure that students are able to access care during those times? There's also an information gap in being able to, in having students navigate, their benefits. One of the first questions we ask is, are you insured? I think most students probably have that insurance literacy these days, but even before the ACA, the Affordable Care Act, at one point, Ohlone had about a 35–40% uninsured rate. And when we asked some students that, some still don't know, or they have it, they're not sure what kind of plan they have, particularly if they're still under their parents' plan. And then the other reason is that we really do lack personnel and the time to truly devote to making sure that students are able to, access agencies in the community. And then lastly, students who have more complex mental health problems really simply can't be managed at many of our community colleges. And so all those reasons are the reasons why we decided, let's actually think about how to come up with an intervention so that way our students, are able to access care beyond what we are able to provide on campus. We wanted to ask, how do we improve the referral process? So that's one of it. And then the second piece is, what happens to students and their continuity of care? Are they able to get connected? How are they doing? Are they able to continue their studies? Of course, both of these questions, we have some answers, but we don't still have a lot of answers, and it's something that we continue to really think through. Okay. Now the what. So I want to get into what the actual program is. This is a beautiful photo of our campus and these new buildings. I think we have 3 new buildings. They actually were slated. No, they opened up right about 2 months before the pandemic, and so now we're fully enjoying them now. But I remember how sad we all were when we went to shelter in place, and we're like, wait, we want to be able to experience our campus, with all the new beautiful buildings. So what is the Mental Health Navigator program? This is considered a pilot program still. I don't know how long we go until we can remove that label, but we're still kind of figure it out. So it's year 3 of this countywide pilot program. We recruit students from community colleges who participate to serve as mental health navigators. And students really actually are engaged in a robust training program and what we call community agency showcase, which is something I'll go over in a little bit. I do want to say that this is both a workforce development program as well as a student engagement program. And when I say workforce development, what that means is the funding comes from workforce development dollars, where you really create pathways and pipelines for students who are interested in behavioral health to really be exposed to the career path, and also give them opportunities to kind of nibble and figure out, okay, what is this all about, and is this the right career path for me? So that's the workforce development side. The student engagement side is a term that we use at Ohlone, and it's really bringing students in to become co-creators of interventions. They help. They have an active involvement in advancing student mental health on campus. And so I like to think of this program as both, a workforce development as well as a student engagement program. And the job of mental health navigators is to help their peers navigate the insurance coverage and really linking students to off-campus services. Either one, because what we have at the school isn't able to support students, and 2, which is more likely the case, that they need to be connected to services beyond what we can provide after the students meet their session limits. That's essentially what the program is. Currently, excuse me, there's 3 domains to this. We offer trainings, students do case management, and then there's also a lot of mentorship and social support. And so in terms of trainings, we have what we call a Mental Health Summer Academy. The curriculum itself is actually something that the county commissioned a number of years ago, and since then it's been revised. We don't use the entire curriculum. We probably use about 40% of it, and then I added our own based on what students are interested in, what they tell us they need, and really as the program's evolved, we've been adding and sort of reshaping that. The Summer Academy is week-long. We do it before the start of the school year. And this year we actually decided to add a Winter Academy as well, because students tell us that I just need more training. I need more practice. I need, to learn more about the agencies. Trainings happen throughout the year, not just in the summer and winter, but pretty much on a monthly basis. And many of our meetings include a component of training. We also have what we call community agency showcases. This is where because students really need to understand the landscape, we invite different community-based agencies in the county to come and do what we call a showcase, where some have come in person, otherwise it's largely over Zoom. They come and they talk about what is the mission of their agency, who do they serve, where are they located, is it, BART or bus accessible? BART is our local transit system, subway system. Do they have bilingual therapists? Do they focus on LGBTQ issues? And also, do they support, the development of young people? Not all agencies are as appropriate, for some of our students. And then also we have started going out to visit agencies. It's one thing to see these agencies and to learn about them over Zoom, but it's not until you go out and actually see their physical building and their office space and meet the people and learn about that I think students really get a better feel for it. A couple months ago, we brought our students to the Fremont Family Resource Center, which is only about 4 miles away from campus. And, the agency hosted us. We brought our lunch there and got to see, the 20 plus other agencies that are within that resource center. And it was just beautiful. And I just thought, this is exactly what this program is intended to do, is to really give our students a sense of what is going on in their community, and also how do we actually, access these community-based agencies that are designed to serve, our students and others in the community. So all that falls under the bucket of training. Case management. So students are assigned cases to work on, meaning that when a student reaches their session limit and they say, okay, I need an agency that I want to see because I'm currently, struggling with trauma over sexual assault or what have you. The student or the therapist will fill out a referral form, and then I'll get it, or one of my colleagues on the campus will get it, and then we assign that case to a student. It's a case they will work on, sometimes just for a few weeks, sometimes for more than a month. We do have data to really help us understand how many hours, students are putting into case management. The students, we meet on a bi-weekly basis, every 2 weeks. This year we're trying to do them alternately, where we meet over Zoom one session, and then the next session we go to a different campus to meet in person. We're really trying to bring this back, or not bring it back, but really try to do more in-person things, because it's what students are asking for. And then we have what we call learning collaborative, where during our meetings or outside of that, we do a lot of case sharing. We'll say, okay, who has a case this week that you're really struggling with? Tell us about it. It's similar to what our mental health interns do, during their supervision meetings. But, what are we learning? And also, what are we learning about the agencies? Hey, the agency down the street, how long's your wait list? Do we know? Have you tried calling, and did you get an answering machine, or did you get a live person? So we're talking about all of those things, because the idea is that how do we support our students? How do they support each other? And what kinds of, challenges are they coming across that they can then help each other with? We also provide a lot of mentorship and social support. In another program that I run, our scholarship program, we have what we call moments of mentorship over meals, where we do a Zoom dinner session once a month. We invite different speakers, different therapists, other professionals. And so more recently, I've been opening that session up opening that series up to students from other of my student engagement programs. And it's really been beautiful. The idea of what we call moments of mentorship came from Elon University. And that is that, while some of us are fortunate to have lifelong mentors and assigned mentors programs for the year, sometimes our students can also benefit greatly from, just a casual meeting, or being on a Zoom session and hearing a speaker who then offers his or her contact information. And so the idea is we're trying to really give students as many opportunities as possible to not only meet professionals in the field, but also have them, give them exposure to diverse people. So that way, at some point, they hopefully will meet people who look like them, or who share similar backgrounds. And so we've been really intentional about including mentorship opportunities throughout all of our programs. And then lastly, we also do quite a bit of social events. My business office probably isn't thrilled about that piece, but we do set aside funding to organize a hike or go and have coffee, or in fact last week a group of our students just went bowling, because we think that time spent together, getting to know each other, building trust, building community absolutely impacts the way we work with each other. And also it's that sense of belonging, right? The unconditional sense of belonging that we talk a lot about throughout our campuses. And I know that's going to be something that the chancellor's office will touch on tomorrow. So we're really happy that that's part of our regular offering. And so this is what we're offering now, and I'll mention towards the latter part of the webinar what we're hoping to expand to for next year. The WHO, this is a photo of Laney College, which is not far from Oakland, Chinatown, where I used to go as a kid. And when I always tell my family this, for years, you don't know what you don't know. For years, I dreamed of going to Laney College when I got older. And so every time I drive by this campus, I always smile and thought, oh, I was such a dorky kid. We've had 3 cohorts. The first cohort was back in 2020, 2021, and this is one of the photos. And it was all over Zoom. That was the first year of the pandemic. In fact, I think I've only met maybe 2 or 3 of the students in person to this day, but we stayed largely all over Zoom. And it was really a beautiful cohort. Students were so great about just helping us, build the airplane as we're flying, as we like to say, during the pandemic. The nice thing about this particular cohort is that I did have a graduate student intern that year who really helped, support the program. And also this cohort had a few older students, which I think was really helpful too, when we're trying to pilot something and not always sure what we're doing. And they really brought in a unique perspective to this work. And so I just give a lot of gratitude to this first cohort who really helped shape the program to be what it is today. This is last year's cohort. So that was cohort 2. I think about half the group were a little bit more of a traditional, student age. And towards the second semester, we started to actually come out of COVID and had a few meetings in person, but really started to do social activities together. And you can see here the group hiked Mission Peak. I love, and I didn't make it to the top like the rest of the group did, but they did, and it's really one of my favorite photos of them. That was last year's cohort. This year's cohort is this group here, and every year they also put together a flyer that we put, on our website just to introduce the cohort. And so that's the beautiful group this year. And I want to acknowledge the students from this year. We have 2 from Chabot, 2 from Laney, 1 from Las Positas, and then 3 from Ohlone. And Gabriella, whose name I marked here, she's actually going to be one of the students featured tomorrow during our short session. She's actually a returning student, a returning navigator. She loved the program so much, she asked if she could continue, and I said absolutely. And so she actually serves as not only a senior navigator, but also a program assistant to the navigation program. And she'll be joining us again next year. So I'm really thrilled about that. And, this is the kind of, I think, pathway, right, that we talk about. How do we bring students to this work and, give them opportunities to really immerse themselves and Gabby is headed to hopefully next year. She's already transferred, so she's actually still taking community colleges, but has already transferred to CSU campus, and hopefully will apply to graduate school and become a bilingual therapist, which is something that we sorely need in our community. And so I'm so happy to share these kind of stories, because I feel like this is exactly why these workforce development programs are needed, and why we're doing the work that we're doing. I want to share a history of the 7 community colleges in terms of their participation in the program. We had 4 campuses the first year, 4 campuses the second year, and then 4 campuses this third year. And next year, I'm really excited because it looks like we'll get 6 of the 7 campuses to participate. Recruitment is actually happening now. We actually have, I think, 37 applications that came in, and all the interviews are happening this week. And so it's a busy week for us, but we're so excited that, we're going to be expanding to, and pick up a few, 2 more new campuses, College Alameda. Oh, excuse me, one more new campus, but BCC Berkeley will be returning to participate next year. So yeah, so I'm thrilled, and I'll have to share this with our funder, but the idea was, yeah, could you organize this so that way all community colleges in the county participate? Because not only do we want to address this issue that I talked about from a really systemic level, but we want to build that critical mass, right, of not only our cohort of students, but so that our agencies who are, hopefully in the process of taking on some of our student clients, will see that, oh, okay, this is coming from, the network of community colleges, and that they really think about, how to perhaps serve our students in ways that are a little bit different than say from community members. Okay, the how. So how we do this program, photo of Las Positas College, which is another beautiful campus. We apply 2 different theoretical frameworks. I'm not going to go over it, but I do want to share that because it does help us think through how we are able to deliver curriculum, and also how we want to approach this program. So we use Maslow's hierarchy of need, and with it really a heavy emphasis on basic needs, which I'll talk about in a little bit, because that's actually going to be a big feature for next year. And then we really apply the social learning theory to this work, where students get a lot of training because, well, one, they need and they ask for it, but also it gives them a chance to really then apply that training to the work that they're doing. And so I want to say, for the case management piece, I forgot to mention this, the first year, or maybe even the first 2 years of the cohort, when students are first assigned their cases, we actually had them pair up to manage their first 2 cases. And then after that, if they felt comfortable, they can then manage their own cases. All the other campuses went with that model. At Ohlone, our students were like, no, we love working with each other, and they felt, that they could do the work better when they work together. And so at Ohlone, at least the first 2 years, our students said, no, we're just going to continue pairing up and actually manage the cases together. And so it's each campus is, functions a little bit differently, but I do want to say that there's a lot of flexibility into this too. I mentioned earlier the training curriculum that we use, a curriculum that's actually based on wellness, recovery, and resiliency. I think that's the full name of it. Some of that content is on here, but others are not. And so this is just I wouldn't say a short, but a decent sized list of what we do cover. You can see here, covering mental health, what's on campus, your campus-based mental health services, confidentiality and mandatory reporting, the continuum of care, looking at healthcare options, really trying to understand health insurance is something that our students continue to tell us they need more of, they want more of. What does what does Covered California look like? What does the marketplace look like? So we've had somebody from Covered California come and at least give that basic foundation, and then if we add other training topics to this, we even cover ACEs, adverse childhood experiences. And then in terms of community agency showcase, these are just a handful of agencies that have come to talk to us about their program and how they can serve students. I think we're up to almost 20 at this point, and it's largely in Alameda County. There are a couple agencies that are based in Alameda County, but their service area extends to Santa Clara County or even Contra Costa County. And that's okay, because our students do come from, outside of Alameda County. It's just that we want to focus heavily on Alameda County because that's where our 7 schools are. And we're just delighted, over the last number of years that we've been able to really build relationships with many of these agencies, to the point where, for some of our showcases, it's the same person who's been coming year after year to meet the students. And so they're getting a chance to know about the community colleges, but also, my goal is I would like a contact person. Well, we can say, okay, if you call side by side, talk to Jenny. She knows our program, she knows our students, and she knows the struggles that are maybe some of our students are having trying to get an appointment slot. We're not there yet, but that is, actually one of my goals is to really do that. And I want to say the Korean Community Center of East Bay is probably one of those agencies where we've had that relationship. Part of it is because I actually know the program director there from a previous job, but the fact that they've come to our campus, we've been to their agency for a site visit, and we do have a person that we could literally call, we're trying to connect one of our students to. And so, and these efforts take time, as you all know. And so that work is done largely by our students. With a little bit of my support, but I would have to say it's really the students who are taking the time to cultivate these relationships and really, try to stay on top of it. Okay, I'm going to move us on. I want to talk about the referral process. So I mentioned earlier that when students are in need of a referral or some sort of navigation support, they will fill out a form or they will connect with their mental health therapist and figure out whatever that campus's protocol is. And so I'm going to share 3 different things. Las Positas College. This is the referral form on this side and then the flow chart. Every campus we ask to create a flow chart. What happens, from the time a student requests a navigation service until they finish, their case. For Las Positas, I absolutely love the referral form. I don't know how to enlarge this. Hopefully you can see it maybe closer when you're able to download the slide deck. But I'm hoping to get all of our participating colleges next year to adopt something similar. And, maybe we'll just take this and throw a logo on it, but it's absolutely great. They have the date, the name, but in the middle section here, students are able to check off what kinds of information or assistance they may need help with. And so you've got here your basic needs up there: food, housing, health insurance, and then campus services, housing services, insurance services, additional counseling, food services. I mean, I absolutely love this. And so even ours at Ohlone, the host campus, isn't as robust as this. And so I'm hoping that we can all get there. But it really helps us get a sense of what the students' needs are. And then for Las Positas, their referral, their flow chart, you can see here, a student visits a wellness center. They fill out an intake form. There's an assessment. We agreed that our student navigators are only going to try to reach their student client up to 3 times. The struggle is that sometimes students don't respond. I'm sure you all know what that's like, and our students are actually struggling with that right now. And so we're always trying to find ways to figure out how, is it making sure that your first meeting with your student client is in person, if there's space at the health center, is it, communicating by text message, which is what we're finding the preference for most of our students. Is it sending out a Zoom link and making sure that, the time works for, the client? I mean, we're really trying to explore how to make sure that that initial meeting happens, right? Because that's obviously the beginning of the process. But students can't help other students navigate if the client isn't, for whatever reason, able to show up for their first meeting. This is Berkeley City College. This is their flow chart from last year. They're not participating this year, but I wanted to share this as an example. They will be returning next year, but their referral, their flow chart is, there's a referral, and then the navigator will contact, and then the navigator will support, and then the navigator will document, and then they close a case. Every campus has your own, way of documenting the case itself, what the needs were, and then what happened to that particular case. So that's Berkeley City. And then this one here, I don't actually have a flow chart for Ohlone, but I'm happy to share it, just not during this webinar. But this is our referral form and what we call release of information. We actually have this form as a link in SharePoint, which I think many of us use if you're on Microsoft. But you can see here, it has their name, their preferred name, email, their preferred time for meeting. Sometimes we go back and forth a lot trying to figure out when's a good meeting time. So we just ask up front, when is a good time for you? And do you have access to reliable transportation? And this is actually one of the proxy questions that our students want to know ahead of time, because then when they're starting to research, a community-based agency, they can figure out, okay, do I need to find something that is BART accessible or that is, close by a bus stop? Or what have you. And then we actually always ask which mental health counselor did you see, because we want to make sure that all of our counselors and interns are referring it, but also we can also follow up if need be. And then we ask them for a brief description of what their needs or wants are. And then of course we do the release of information here. At Ohlone, our mental health team will provide a link to this form to our students. Whereas perhaps another campus, they might, they have a different form and they might fill it out together, or maybe, or the counselor may start it and then hand the form off to the student to complete the rest of it. I want to say Chabot might do that. I can't remember exactly their process, but they've got a different form than the rest of our campuses. And then I want to just touch base on the the campus-based mental health liaison. And so this program only works because we are coordinating it with our clinicians. And so at my campus at Ohlone, Julie Navarro is our full-time mental health counselor. She, knows what's going on, and she helps, really promote the program to her team and the interns. Except that I think my role and her role overlap in terms of our case management. Whereas at a different campus, and I'll just say at Las Positas, Sheena is the mental health therapist there, and they only actually have one navigator. And so what they do there is when Sheena gets the referrals, she'll assign all of them over to, Emily, who's a navigator over there. And so things work a little bit differently. But what we ask of our mental health liaisons for these campuses is that they support recruitment efforts. And so, like I mentioned, we're actually going through that right now, recruiting for students, doing the interviews. And so they've been helpful in, helping us get a table so we can do some tabling, or getting the message out to their campus email, announcing this program application. During the beginning of the school year, they help our navigators develop the referral protocol, what's going to work for their campus, so they do that. They assign the navigator cases. And then we invite them to our cohort meetings each semester. We haven't had full participation yet, but I'm really hoping that as the program continues to grow, that our liaisons hopefully will make time to meet our students. In fact, I'm thinking of probably doing like a in-person meet and greet next year. So that way all of our navigators can actually meet all of the mental health therapists within the network. But also, just, have everybody feel more connected to the program. And then we ask that they support their campus-based navigators efforts. If the student's running into a trouble or can't get a hold of one of their students, they can step in. And that actually has been what some of our navigators have told us, that, oh yeah, my student hasn't been responding. And so I reach out to Portia, the mental health counselor, and she was able to ping her student to say, hey, please respond to so-and-so's message. I haven't quite quantified how many hours all this takes, but my guess is maybe 1 to 2 hours a month. But I don't know, I could be wrong, but I'll definitely figure that out as we end the year and really reach back out to our liaisons to talk about how their year went, and really what to expect for next year. Dr. Daniel Eisenberg was on the webinar yesterday from UCLA, and he and his colleague Ashley, they're just terrific. We so enjoy working with them, and he and his colleagues from the HMS study came out with this literature last year, and it's called Mental Health in College Populations. It's a multidisciplinary review. And one of the things that he mentioned yesterday, and I remember him mentioning it before, which is why I dropped the slide in here, was that when we think about prevention and early intervention, or just intervention efforts for our students, we find that things that are skill-based interventions tend to be more effective. And I haven't not conducted a robust evaluation of this program yet. We're hoping at some point we can, but I think the idea is that because this is both a workforce development program and student engagement program, it really is built upon the development of skills for students. And again, that part of what I said earlier about really inviting students to be co-creators in interventions. I'm hoping that this program model and the idea itself is rooted in some level of evidence. And so we'll see, but My ask of all my colleagues is, for counties that may be ready, would love for others to really try out this model and see, what kinds of results you're getting. Communication, how do we communicate with each other and with our student clients and with just the general student population? I think this is also LPC. I can't remember which college this is, but yeah, I think it's LPC, Las Positas College. We actually have an app. And so this was actually something that was done by one of our students from the very first year, Tyler Bennett from Berkeley City College. He said, I can't keep track of all these agencies that we're learning about in an Excel spreadsheet. I'm going to create an app for it. And so we actually have an app, and these are just some screenshots of it. And so the idea behind this was that, like I mentioned, the students just wanted to have a better system to track what they're learning and to figure out, who's got a longer wait list, who doesn't. And so they just thought, a spreadsheet's not fast enough. We just need some sort of tool out there. And so the app itself, it's not like using codes. I don't even know I'm using that terminology right because I'm not a tech person, but it's basically using a Google Sheet. Students will go in and populate information that we're learning about from the different agencies into a Google Sheet, and then the Google form I guess it's automated. I'm not doing a good job of explaining this, but in any case, it's not like code related. There's a platform called Glide that turns your Google Sheet information into an app, and so there isn't an background programming business. We don't store any client information on the app, and it's HIPAA and FERPA compliant. And what does it contain? It contains basically a list of all the agencies we've been learning about. The QR code is incorrect, so I will replace the QR code and send it to Jerry, and she'll post the correct one. I learned from one of our navigators that I am not up to date as they are on this app. But yeah, so for example, maybe they'll put in LGBTQ as a search word. Then on the app itself, a list of, maybe 3 agencies that we've learned about, may come up and say, what, these 3 agencies actually have therapists who perhaps specialize in this topic area. And so it's an internal use, but we actually have shared it with the county. And the idea at some point was, could we expand this to make it a little bit more usable for others? That conversation hasn't really gone anywhere, but that's okay because we have enough to, work with. But again, this is the creativity of our students. They know technology, they're familiar with it much more than I, and this is what they came up with, and we just go with it. And also, actually, I don't think it costs us any money. I don't remember, at least I don't remember paying for it. But in any case, it's one of the things that the students came up with to use. And then in terms of how we communicate with each other, because we have students from different community colleges, we all can't be on Microsoft Teams. I forget the name of it. But anyway, students actually suggested the use of Slack. I put in here a screenshot of what my Slack looks like. It's very pretty because I like this color and I like Hello Kitty. But here's a screenshot of my own Slack, and it's how we organize all of our student work and by channels. And so you can see here under the navigators, we've got, a general channel. We've got one by each school. We have one for all of our trainings, and students love it because they can get on Slack, which is a messaging platform. They can get on Slack either on their desktop or laptop or even their phone. I actually have it on both mine as well. And we use it probably 85–90% of the time, and then email the rest of the time. And it's just a much better way to really communicate with each other. And again, we do it because it's what students prefer. It's not what we prefer. And I want to say Slack is really generous in terms of the pricing for educational institutions. It's 86% off. So I only pay about $1 per user per month. And so it's not very expensive. I've got about 40 users within our different programs on Slack right now. So it's a good investment, and you get what you pay for, and we love using Slack a lot. So I just want to highlight this platform. I think I've got a couple minutes left, so I'm trying to speed up here. We also have a podcast program that our ambassadors run. But they're generous enough to let our navigators crash the program. So we actually produce a few episodes talking about the work that the navigators are doing, what they're struggling with, and what they're seeing. And so that is our podcast. And then data and evaluation. I am only sharing data from last school year because this school year we're going to wrap up in a few weeks, so I haven't compiled all the data either yet. But during the 2021-2022 school year, we had a total of 91 cases that came to us. Majority were females, and I want to say a little more than half were successfully managed. That's a loose definition, and I don't have time to go through all that, but we do track, how many cases are coming in, what kinds of support students need, how are our navigators managing it, and what happened, right? That was one of the first questions I put on here is like, what's happening to our students, when they're accessing community-based referrals? And then down here, you can see the number of cases broken down by schools. Some schools have more cases than others. At Ohlone, we're trying to increase our cases. And then I always do pre and post, measures. And I have, I'm only sharing 2 of the slides, but we have a lot more that we're measuring, obviously. But here, their ability to talk about campus-based mental health services, community-based services really went up, and that's part of the goal of the program. And then in terms of, how the program supports their efforts, I love this one, make you feel a sense of belonging in your college, that increased a little bit. This one here, our funders really love, help you solidify your career choice, that absolutely went up. And again, this is why this is a workforce development program. We really want to expose students to what this career could look like. Okay, Jerry just gave me the 10 minutes up, so I'll try to wrap up in 2 minutes so we can have questions. But I included here a few quotes around program challenges, not having consistent support or connection with the mental health team, other than saying learning about mental health related resources is just too many and sometimes a bit confusing. Very true. So, this program has a number of challenges that we're trying to constantly address. But also, we're so happy to see that it has a lot of rewarding aspects as well. Somebody said this cohort has been my closest friend since high school and learning online. That was probably from the first year. Making small positive differences, whether it was for the client themselves or even just helping the mental health team at my school so that I have more time to help even more students. It's such a feel-good program. I love it and I adore our students, and I know that regardless of how many cases they're getting or what they're struggling with, we know that this again is an opportunity for them to skill build, to meet others, to form connection, to form community, and to really feel that sense of belonging at our campus. And I'm going to finish up here. This program is funded by our county behavioral health services, specifically the workforce development program. And here's how much money we got. This is something I always get asked. The first year we had 30,000. I don't even remember if I paid myself, to be honest. This year we're at 75,000, and next year we're still waiting for a contract, fingers crossed, but they told me it's coming in. They more than doubled our funding to 200,000, and it's just phenomenal. And so I want to tell all of you to knock on your county's door and specifically their workforce development, say, what kinds of funding do you have that you can really invest in our students? Because honestly, from hearing from my colleagues at the county, they absolutely want to connect with community colleges. And this is the exact type of population that is really designed to grow the workforce, and so so I'm happy to talk to anybody around, what this paid for, which is all of our student stipends, my time, our resources and what have you. And I want to give thanks to Sanjita Mazid, who she just retired a few months ago, but she was really the person behind this. I met her at a meeting one day and we were just talking about this problem we have. And next thing you know, she said, send me a proposal. And I think I put one together in like 4 days. And next thing you know, this was like March or April. Next thing you know, by July, we had a contract in place and we literally were just trying to figure out as we went. But I really want to give her props because without her leadership and really her belief in our system and our students, we wouldn't be in our 3rd year today. And so thank you, Sanjita, for not only being a great leader and manager of the workforce development program for our county, but just a wonderful colleague and really a mentor to me. And so I'm really grateful, and I want to just give her a shout out because we didn't get to really celebrate her retirement as much. And then looking forward, like I mentioned, our 6 schools, we have 6 of the 7 schools who will be participating next year. And what we're going to do is continue with the trainings, but we're going to add on more health topics. We're going to actually have students think, have all of our campuses meet with our basic needs office, because we want to make sure that part is really highlighted and figure out, you know, how much can we also support our basic needs office in terms of the work that they're doing. And then continue with mentorship and social support. We're going to start a mental health journal club. And also we put in the budget that we're going to bring our students to a mental health conference next year, which I'm really excited about. And then for all of you, I think this is my last slide, I promise. What would I like for this, you know, mental health action week is for you to take action, for you to re-examine what you're doing. What does your referral process look like? What does documentation look like? And how do you vet your CBOs? And I would invite you to invite, oh, I forgot the S here, invite students to be co-creators of interventions. I've said that a number of times already, to be partners with your behavioral health agencies in the county, as well as your community-based agencies, and also to innovate. Can somebody, you know, replicate this model and share findings? Because we don't know, we don't think any other county is trying this out, but we would love to see this happen. And then it's also in the peer review literature. One of the students from the first year and I actually wrote a very brief article about the program the first year, and it got published in the Journal of Health Promotion Practice. So we were very delighted about that. But again, it gave one of our students a chance to write this up and contribute to the peer review literature. And I'm done. Okay, sorry. Go ahead and I don't know how to stop screen share here, Jerry, but if you want to stop that and take questions, I'm happy to answer questions we have in the 5 minutes remaining.
Thank you so much, Sang. That was such a wealth of information. I feel like it was a fire hose of information. Thank you so much for putting together that presentation. We got so many great questions. We aren't going to be able to get to all of the questions that we have. So just a heads up, Sang and I will be working together to put together a Q&A document that we'll send via email and make available on our website after today's presentation. So if you submitted a question and you don't get an answer today, you'll get an answer on the Q&A document. I just wanted to draw your attention to that. I think that a good place to start was a question came in through the chat. Can you talk about the first steps that you took to begin planning to implement this model? You said that you met Sanjita at a meeting and you started building that relationships. What other relationships did you find to be pivotal to get you into the action?
Yeah. So in Alameda County, because Aloni got one of the mental health grants, we actually put on our work plan that we were going to mobilize the other community colleges in our county. And so we started what we call the Alameda County Community College Mental Health Forum. And so Aloni and Chabot took turns hosting it. And the forums was a place for our community colleges to come together at a countywide level, and because we were getting together, we thought, well, we shouldn't be the only ones meeting, we should invite our county. And that's at one of those meetings was how I was able to meet Sanjita. But I have to say, really, like, look at how many community colleges are in your county and reach out to those folks. Do you know them? Mm-hmm. I have had the pleasure to get to know all but one campus so far, and have gone out to those campuses and meet with my colleagues and say, hey, what's going on? Could we do something together? Could we collaborate? And that's why I think we're going to have 6 of the 7 colleges participate next year. And so I would say, we don't have to go very far. Go to your nearby campus and meet with the, your colleagues and try to figure out, are there things we could do together? Maybe we don't have a shared referral form, but maybe we can at least say, hey, these 3 agencies I'm very familiar with, and maybe that's something you might want to put on your referral form as well, because we've already took the time to vet them and actually know them. So that would be, I think, my very first and foremost. And then, I don't know, find a fast writer. I've been asked to put lots of proposals together, and I'm okay. Give me 48 hours. Let me just kind of get to my computer and think. I said a coffee bean.
That's fabulous advice, and thank you so much for that. And we've only got about 2 minutes left. I'm so sorry to end the questions after just one, but we will take a look at the questions that are submitted via the chat or in the Q&A box. So if you have a remaining question, please feel free to add it, and we will be sure to include it on the document. So on the slide, you can see that the recordings are going to be available. We're going to make them available along with the PowerPoints, including the updated links and the QR code Thank you so much for taking the time to be here today. We hope you're able to join us tomorrow from the Chancellor's office starting at 9 a.m. and a link to register is available on the website. If Jackie could add that website again. Thank you all for being here and we appreciate your time. Look forward to seeing you again later this week.
Jerry, can I just say one last thing?
Yeah, please go ahead.
We would love for other schools to think about this. I'm happy to send over the copy of the curriculum. I'm happy to send over a copy of the proposals from each year that I've written to get this funded. I'm happy to send over whatever, you know, we just want somebody else to try this because I don't know, maybe this isn't the way to go. Maybe I have this completely all wrong. I mean, there are days when I'm like, I don't really know what I'm doing in this job, but we figure it out as we go. But again, it's really the students, right, who are part of designing this and trying to help us figure out how to best serve their peers. And so I'm happy to, you know, partner with anybody or just provide technical support and trying to get this off the ground. But thank you, everybody.
Much. And I'm happy to coordinate that support. The California Community College Health and Wellness Program is here to support you in your college success as well. So if you are having challenges or you're interested in implementing this program at your college, please reach out. We're happy to collaborate with you. If you have a mental health need or training need for your staff or students on specific topics, we can help to coordinate that too. So thank you so much for your time today. I look forward to having you join us the rest of the week, and please don't hesitate to reach out. I'm going to add my email address to the chat. Thank you everyone for being here and hope to see you again tomorrow at 9. Bye everyone, and thank you Sang for your amazing presentation today. Really appreciate it. And thank you everyone. Enjoy the rest of your day.